Hello, my name is Dorian Royal and I'm a nurse practitioner at Mount Sinai Hospital. I work in the Attending Directed Service. I'm also the Vice President of Amazing Grace Children's Foundation, which is a nonprofit organization that provides care to women, expectant women and children in Ghana, West Africa. This project was in affiliation with the Amazing Grace Children's Foundation. In an effort to support the initiative of the Ghana's National Action Plan combating antimicrobial resistance, Amazing Grace Children's Foundation had a national antimicrobial resistance awareness campaign launch in February of 2020. Antimicrobial resistance is a growing epidemic that contributes to more than 750,000 deaths per year, more than 400 diagnoses of multi-drug resistant TB. It has complicated the care of patients with HIV and malaria, and in essence is a threat to global health and human existence. And so with this in mind, the campaign was launched to support the action plan that's already in place in Ghana. They recognized that in order to be effective, this had to be a collaborative effort, and we had to engage sectors in the human health and the food and agriculture industry, that we had to promote collaboration between different agencies and different professionals in order to respond to the AMR crisis. This project supported the global and the regional efforts within Ghana to support the AMR framework. They focused primarily on two of the initiatives in the National Action Plan framework. They have 5 objectives, and the campaign focused on 2 of those. The first being to improve awareness and understanding of antimicrobial resistance through effective communication, education, and training. Representatives from various sectors provided education on effective laboratory diagnostics, on prescribing and using antimicrobial therapy and what providers should know, on the updated guidelines for antepartum care with Group B Streptococcus, and the science of antibiotics. The second objective was to reduce the incidence of infections through effective sanitation, hygiene and infection prevention measures, and good agriculture and biosecurity practices. These included the One Health approach, zoonotism, the effect of AMR on food production and nutrition, and the effect of AMR on economic growth and food and agriculture. These all help to provide information on the future of AMR in this global crisis and the crisis that they're facing in resource-challenged areas. The project was launched in association with Doctors in the Gap, the Pharmaceutical Society of Ghana, the Medical and Dental Council of Ghana, the Pediatric Society of Ghana, representative from the World Health Organization, and the Ghana Ministry of Health. In attendance were participants from the community. We had Queen Mothers from varied groups, medical students, nursing students, nurses, doctors, pharmacy students, members from the public health sectors, and the media. In summary, we recognized that combating AMR is driven by interconnected factors, and that convening allows for acknowledgement of isolated interventions that were already happening across various sectors, and created a platform to unite these interventions so that we could all achieve one common goal. It brought awareness, public awareness, and a recognition that building awareness targeted specific population and behavior changes within those population. And it also highlighted the guidelines on infection control that was the guidelines that were implementable and relevant to those in Ghana. For future discussions, we would like to see more education surrounding antimicrobial resistance in medical programs and in nursing programs. And we would like to see involvement of high stakeholders because we think that this is one means of making antimicrobial resistant programs sustainable. Thank you for listening.